So let's talk about labiaplasties. Labiaplasties become very, very common. It doesn't matter whether it's 18 years old all the way up to 60, 70, even 80 years old. The labia is something that's very personal to women, and it often bothers them. Everybody loves to talk about the new facelift, the new breast implants, but a labiaplasty is obviously something that's much more personal that people typically don't talk about, but it's become a very common procedure. Whether it bothers you in clothes, bathing suits, running, bicycling, or just personally, labiaplasty is a quick, easy procedure that can fix that. So first of all, let's look at the anatomy of the area and then look at what bothers most people. So from an anatomical standpoint, the labia majora is the outer lips of the vagina here. The labia minora is the inner lips here. Most of the redundancy in the labia minora, which what bothers most women, is in the back portion of the labia here. Most of the sensation is up around the clitoris in the front part. So two ways you can do a labiaplasty. Unfortunately, the way a lot of GYN surgeries do labiaplasties, they just trim them off. It's called the trim method. And when this is taken off, unfortunately, it distorts the normal anatomy of the vagina because you're losing that nice, pretty edge to the labia. And you can actually affect the sensation because you're removing part of the labia up around the clitoris. Most of the redundancy, again, is the back, most of the sensation to the front. So as a plastic surgeon, the way I do labiaplasties is a posterior wedge labiaplasty, where I'm taking out the back part of the redundant part. The front part then rotates in and tucks in this way. That way we're keeping the nice, pretty edge to the labia. Everything folds in nicely and looks very nice. That's called a posterior wedge labiaplasty. It can be easily combined with a clitoral hood reduction, so that when this part was pulled forward, if there's extra skin around the clitoris and in the hood, we take a little small wedge of skin off in the front, helps improve the sensation, the sensitivity in that area. So in my opinion, the better way to do a labiaplasty is a posterior wedge labiaplasty, because it preserves the normal anatomy and actually can improve the sensation and sensitivity.